You're not trying to get pregnant?
Past those days.
Okay. That's its main side effect. If honestly, it gets you pregnant, yeah. Actually, that's a great joke. Actually, I'm gonna steal that. All these vessels along your nose are still holding off pretty well. I do see maybe one here coming back a little bit. So yeah, we can zap these guys. All in all, it's still improved. I'm Dr. Abaji, and today what we're gonna be doing is a procedure we call the Vbeam laser. We use this laser to target the red color that's in the capillaries that affect the nose and the cheeks, often in people with rosacea. The laser is gonna go after those vessels, and the energy of the laser essentially either causes them to pop or causes them to collapse. Now, if they collapse, you can see an immediate change. If they pop, you might get a little bit of bruising. Whether or not you want bruising kind of depends on what you're trying to go after. For some vessels, you actually might want to see bruising because it gives you a sign that you definitely got it, and as it heals, it's more likely to go away. Now, that endpoint might not be what people are looking for when they walk right out the door. So you can tailor the settings to make it not likely to bruise, but you can still see an effect. It might not be as effective as if you walk out with bruising. Our patient has rosacea, and one of the symptoms of rosacea are prominent telangiectasias of the cheeks and nose and other sites of the face that are most affected by sun. That chronic inflammation from the sun, the damage to the elastin in the skin, all of that can lead to more prominent blood vessels of the face. When you do the Vbeam laser, you're targeting those specific blood vessels and focally treating them so that they can either collapse or pop, but you get them to eventually heal and go away. Now, they might come back over time. In that case, you need to repeat the procedure, but gradually as you repeat it over and over, they'll stay away longer. You might get to a point where you only have to do a touch-up every now and then. So with this laser, we have the options of changing the energy we deliver, the amount of energy, also something called the pulse width, which is how long it delivers that same amount of energy, and the cooling, which is how much cryo it can squirt on the skin to help keep the skin cool after we blast it with energy and heat. So all of those parameters can affect the results that you're trying to get. You adjust them based on what you're trying to treat, and that's part of the expertise of using these lasers in the derm world. Linear vessels that I can trace out with the laser and zap them as I go. I'm looking for immediate collapse of the vessel as an endpoint. But yeah, that's gonna be nice. You're gonna be a little bit more red tomorrow. That's okay. And then let that fade.
Yeah.
And then you won't be red, and then those vessels will be gone.
Great.
Yeah. Now, 3-4 months from now, longer, hopefully, if we need to touch it up, we will. The first three here, the wash, the scrub, the pads, those don't make you peel, okay?
Right.
Those just keep your skin really clean, really nice. The wash gets rid of all the oil. The scrub gets rid of dead skin. The pads clean out the pores. When you do those three in combination, you are also removing barriers of penetration for the rest of the creams. So right now, complex A is making you notice that you're red, you're peely, you're dry.
Right.
Okay, so what I would say is you can switch to one called wrinkle texture repair.
Okay.
This one is about half as strong as complex A.
Okay.
It's not going to make you so red, so dry, so peely. You should be able to handle that, no problem. Okay. Now you are on maintenance. This is when I want you to enjoy your skin. If you feel like even every night on wrinkle texture you're more red and peely than you want to be, then give me at least 3 times a week.
Okay, but ideally every day?
Ideally every night.
Okay.
Moisturizer should still only ever be once in a while. If there's a day here and there that you need it because you're like, I'm so super dry today, it's like extra windy or you're traveling, okay, you can put moisturizer on. But if it's most of the time where you're just like indoors and you're putting it on because it feels good and smells good, then it's not doing your skin many favors.